Swadikap. Good morning once again. Today is Friday, the 15th of January 2021, and this is the English language summary of the daily press briefing here at the Center for COVID Situation Administration, or CCSA. So first off with the general situation and the numbers that we have for today, and a slide will be coming up for you. How many people in Thailand are still actively having COVID? 3,093. So that's a very good decrease in the number, actually, because the other day it was still around almost 4,000. So around 3,000 plus people in Thailand have COVID currently right now. The fact of the matter is that there are more people recovering each day, more than the number of people that have been confirmed as a new case each day. For example, the number we have today is new recoveries, 628 new recoveries, and 188 new confirmed cases. So as you can see, more new recoveries than new cases. And just for the numbers, new confirmed cases, the 188 that we have recorded for today, 81 are cases of local transmission, 73 from our active case findings, and 21 from within the state quarantine, and 13 cases from border crossing points. And I'll have some information regarding our efforts along the border later on. We have had a cumulative since last year, 12 months, 11,450 cases. Total recoveries is around 72%. That's an increase in percentage already. 72% of 11,000 have recovered. And that is 8,288 persons total. But of course, all in all, the question is how many people have actively have COVID at the moment in Thailand today? 3,093. And of course, fortunately, no further fatalities. The accumulation that we have now is 69 fatalities and deaths. Just some observations. The spokesperson mentioned about an important meeting that the Prime Minister chaired earlier this morning. It was a meeting regarding the situation in some other specific provinces in Thailand, in particular the Tak province and the area there, where the province of Tak is actually, of course, bordering the neighboring country of Myanmar. In Tak province, there are plans to build more field hospitals, which would increase the number of beds for COVID patients. It would be around up to 200 beds, in addition to the other additional beds in the regular hospitals are already there. So you have some images there of that meeting this morning regarding Tak province. And of course, we share a long border with many of our neighboring countries. Around the 500-kilometer border area, in that span of border, the border police and security officials are very strict and taking a very rigid approach in terms of the enforcement. There have been many checkpoints along the border area. On our western side, there's actually around 3,000 kilometers, but specifically, I'm focusing on 500 kilometers of that portion of the border. So many checkpoints along the border. Also, locally, there had been engagement with local communities and villages, actually, so that villagers will be on the lookout to be very more vigilant along the border area, to see in plain terms perhaps if there is any stranger in the village or anyone popping up from outside their local area, and to report that to authorities. Of course, that would help in terms of solving illegal entry into Thailand, as well as curbing the spread of COVID from new areas and having a new cluster, a new infection in the country, in that particular area, in the western provinces of Thailand. Nevertheless, there are also reports of Thai nationals in neighboring countries who wish to return to Thailand through illegal means. Of course, the enforcement will be strong in that front. Fortunately, some Thai nationals have returned Now, through legal means, for example, a group of 152 Thai nationals entered through under the eyes of the authorities, so to speak, and they entered into the quarantine system. So this group of 152 persons entered into the local quarantine, LQ, in the provinces, and of that number, 152, we found that 15 were COVID positive, and they have been included in the number of new confirmed cases as reported today, 188. So just an update on various restrictions in provincial areas. Of course, we have granted the authority to provincial governors to impose appropriate disease control measures according to the context and according to the situation of each province. And just to update you on one particular province, yesterday, the governor of Kanchanaburi province ordered the closure of hotels and resorts in the province to prevent interprovincial travel. Too much of interprovincial travel into the province of Kanchanaburi. Many of you would be familiar, of course, with Kanchanaburi, where all the mountains, the mountain scenery are, nature. So this, as the number of confirmed cases in that province has indeed risen. So in the statistics that Dr. Thuisin showed us just now, Kanchanaburi was part of that equation, that there were more cases in Kanchanaburi in recent days and weeks. So this action is very timely for the province of Kanchanaburi. Of course, still, we strongly advise everyone to keep yourself informed of the measures in each local province as well. If you live outside the capital, of course, trusted news outlets, official releases, and of course the briefing here that we have to you every day. So just to recap, every day sometimes we have to recap the number of provinces for you to keep a tab on that. So since the beginning of the new outbreak, 17 provinces across the country still remain COVID-free. We have 77, so 17 still remain COVID-free. That means that 60 have at least one case. And there are 20 provinces that have not found any confirmed case in the last 7 days. So we're talking about a span of time here, that in terms of 7 days, no new infections in 20 provinces. So that time gap or time lapse, number of days, is very important, because the longer those days are, it means that the measures are proving to be effective. If these 20 provinces have no case in 14 days already, or if in the future 30 provinces have no cases in the 14 days, it means that the number will actually get very much lower. So we have announced that restriction measures on certain provinces could be relieved, actually, according to the situation in each province. Some measures in some province may be relieved, may be lighter, as soon as the 31st of January, as soon as the end of this month, if, and there's an if to that, if the situation remains positive. And this date has been set after a 28-day interval following the announcement of the nationwide restriction on the 14th of January 2021. So 28-day interval, 14 days incubation period times 2. Another piece of information important is about the registration of migrant workers from neighboring countries. From Laos, PDR, Cambodia, and Myanmar, workers are now able to register for legal employment, allowing a 2-year stay. We've talked about this, and I'll repeat here that the cabinet earlier approved this measure in an effort to control COVID after the outbreak in Samut Sakhon affected a large number of migrant communities. The migrant workers from these neighboring countries are able to register with the Labor Ministry's Department of Employment from now until the 13th of February. And employers can submit names of their employees that they wish to register in the ministry's e-work permit website. They must go through health screening before submitting the work permit application, which has to be completed. And migrants or their employers are obliged to pay the fee to cover the health screening and 2-year health insurance. More information on the Department of Employment website at worldwideweb.doe.go.th, as you can see on screen. Taking this opportunity also to reiterate that the Thai government and Thai people always regard migrant workers from neighboring countries as friends, as part of our society, important personnel, important workforce who support the Thai economy. And as such, migrant workers deserve to be treated with dignity, enjoying decent conditions, and must receive the same medical attention as Thai nationals when they face an illness. So this is the principle and policies to which all Thai agencies always adhere to. Today, the regional representative and the Thailand representative of the International Organization for Migration, or IOM, came to meet with us at the Ministry of Foreign Affairs to provide further information which we can make use of and publicize about the partnership and collaboration that we have regarding migrants vis-a-vis COVID. So we'll present to you that information next week, perhaps starting Monday onwards. Vaccine, still an important issue. Vaccine effectiveness. Yesterday, I mentioned that there was a TV program wherein Dr. Yong Pu Warawan, the chief of the Center of Excellence in Clinical Virology, Chulalongkorn University Hospital, was interviewed there, broadcast on NBT channel about the vaccination plan. So just some recaps of that program yesterday that was broadcast in Thai. Dr. Yong mentioned that the priority of the vaccine program at the time being should focus on containing the crisis and preventing infected people from falling ill. That despite vaccines for many diseases had low disease prevention efficacy rates, they could still prevent illnesses and death. The initial result of the vaccine's efficacy rate from the clinical trials also differ among different groups of people. So, for example, certain vaccine, such as Sinovac vaccine, showed disease prevention efficacy rates in various percentages. For example, it was around 65% during its trial in Indonesia, but it was 86% efficacy in the United Arab Emirates, and it was 90% of disease prevention efficacy rate, 90% in the country Turkey. So therefore, all vaccines nevertheless would have to be approved, of course, by the Thai FDA before being used in the country. And the Thai Food and Drug Administration is now collecting and evaluating clinical trials, data in that sort, as well as the reports on the side effects, the safety from the information submitted by the companies, by companies like AstraZeneca, Sinovac, and many other pharmaceutical and vaccine companies in order to provide safety and efficacy assurances to people who would be receiving the vaccines in the near future in Thailand. So just in closing, while it's important to keep ourselves informed of the latest situation, of course, the overwhelming information can cause sort of anxiety, I would say, or worry or anxiousness among people. Of course, as we mentioned often, and the World Health Organization mentioned often, this has been an infodemic, not only a pandemic. So the WHO has issued some advice for people to look after their own mental health and to help others who may need some extra support and care. You have an infographic there on screen. First, important to get the facts, not rumors or misinformation or disinformation that could cause fear or concern, and get information, consume information from reliable sources to make sure that you take also regular breaks from normal on-screen activities. Of course, fear is a normal reaction in situations of uncertainty, but sometimes fear is expressed in ways which are hurtful to other people. Remember to be kind. and I've spoken this quite often, and do not discriminate against people because of your fears of the spread of COVID. Also, try not to attribute to any specific group. Please have empathy. Please be sympathetic to those who are affected. If you feel you need some support, you can always call in Thailand the Department of Mental Health and their hotline, or contact the support groups in Thailand. The Department of Mental Health hotline is 1323. So, thank you very much for your attention today, and have a happy weekend. It's Friday, and we'll see you again tomorrow. Thank you. สวัสดีครับ